Well, less than 7% of children in South Africa have COVID-19. The National Institute for Communicable Disease says children are not likely to be admitted to ICU or to die from this virus. Only 3 children between, infancy and 9 have died from COVID-19. Adrian Purin from the National Institute for Communicable Diseases will give us more insight. Adrian, good morning. And I suppose, we've spoken about children in the past. We've spoken about how unlikely children are to, of a certain age, 9 and below, to actually contract this disease. And I suppose we need an explanation as to why. Why is it? What excludes them mostly from being at risk of infection?
Yes, I think the evidence still has to be found. I think there are some hypotheses as to why children don't present with severe disease. It may well be the maturity of their immune systems and or the way in which their immune systems are able to manage the virus, for them to have, I think, fairly mild symptoms and, in fact, not to progress to more severe disease. So I think there are some either immunological or virological factors that may well play that particular role. But I think this report that you're quoting from, in fact, I think is one of the first reports to really look at some of the laboratory-based data, to look at what the distribution is in terms of infections in children, as well as look at hospitalization of children and the specific outcomes.
So for children who have contracted COVID-19, what does it look like for them? What are symptoms like? Are they experiencing similar symptoms to adults, or is it just merely a bit of a sniffle?
Yeah, so as far as we're aware from various other studies, that they are fairly mild symptoms. And if you look at the proportions of children that are infected, they don't make up the bulk of the infections overall. In fact, it's about less than 7% if you look at that particular report till the 7th of June. So it's a fairly smaller number compared to adults, and their risk as well is fairly different from adults. And obviously, that risk increases with age up to about 10 per 100,000, but overall the risk is much different. In terms of hospitalization as well, so again, I just want to put a caveat here. This particular report looks at specific sentinel hospitals, so that experience may not be universal across South Africa, but it certainly provides important information, is that when there is hospitalization, in other words, they do present with more severe disease, only a fairly small proportion of those particular children, I think it was about 200 children that were admitted, and about only 5% of those particular children that were admitted actually ended up requiring ventilation and or intubation, for example. And of that, only 3 died. And my understanding is of those 3 that died, in fact, those children had comorbidities, and that may well have contributed to their demise.
And some were born prematurely or just newborns as well. So, Prof, I mean, anybody with little kids will know that, if especially that age group, 9 and below, you're sitting with ear infections almost like every couple of months, throat, ear, nose and throat issues as well. So it does strike us as odd that they would be particularly, if I was to say, protected from COVID-19. Or could it be that those who do vaccinate, that those vaccinations that they've had, and I'm just taking a flyer because I know very nothing about this, could it be that their systems, those vaccinations are still fresh in their systems, that might be the thing that goes towards protecting them?
Well, I think we need to be cautious about that. My sense is that these vaccines are very specific, highly specific for specific infectious agents. So I don't see the rationale or cross-reactivity. I know that there's been, for example, you've seen the BCG trial, for example, where it's thought that these particular vaccines may induce some non-specific immunity, for example, cross-immunity that will then protect you against other agents, for example. But I'm not sure that that's clear or how that would actually work. So I would be cautious to say that I would certainly encourage all types of vaccines to be administered to children. I think that's really critical, because that's an important point you raised here, is that in fact we do know that there's been a decrease in the number of children that have actually been vaccinated. So I think I would certainly encourage parents to make sure that the vaccinations are up to date for their children, to protect them against any other viruses or bacteria, for example.
And we're back to school next week, Prof. I mean, what are the things? What are the things we need to bear in mind? What needs to be top of mind for us? Yes, we know the sanitizing. Yes, we know the precautions that need to be taken, but just not letting our guard down, I suppose, on any level.
Absolutely. So I think what this particular picture paints is that children are at lower risk, in other words, in terms of acquiring disease, And in fact, we think also about transmitting disease and the severity of the disease. So I think that's one level of comfort. But obviously, in terms of the school environment, there's exposure to adults, for example. So I guess it's the adults that are of concern, and if there are comorbidities around that. It's also around the school setting. You raise those important points. Again, it's the non-pharmaceutical interventions that will be critical at the school around staggering of times, limiting class sizes, the physical distancing, the wearing of masks, the hand hygiene, and so forth. So those are really the key things. And if the schools go through those checklists to ensure that those things are in place, and I know schools are struggling, then I think those decisions can then be made around that. But I think the comfort is that at least your children, in terms of risk and in terms of disease outcomes, should be in a good place.
Yeah, best time to be a child, I suppose, in this time. Very few can say that. Well, thanks very much, Edwin Purin from the NICD there. Just how COVID-19 is presenting in children or not, and what makes them different. Well, lots of question marks still over that one.